key, keep it softly spoken, with no strings tying you to me.
Pubic lice, genital area.
What is pubic lice? Pubic lice, also known as crabs, are very small insects that infest your genital area. They are called as crabs because they have features that resemble a crab. Pubic lice feed on human blood and can cause intense itching. They usually live on pubic hair, but in rare cases, they can also be found in eyelashes, armpit hair, and facial hair. They are smaller than body and head lice. How you can get pubic lice? The most common and typical way of pubic lice transmission is through intimate contacts, including sexual intercourse. However, it is also possible to catch pubic lice through sharing of towel, blanket, and clothing with people that have pubic lice. Adult lice lay eggs on hair shaft near the skin. These eggs, which are called as nymphs, will hatch into nymph cells 7 to 10 days later, and they will start feeding on blood, skin. Even though pubic lice can cause pretty intense scratching, they don't cause serious health problems. But if left untreated, you can develop infection from scratching.
Pubic lice. My cousin might be infected with this. What should I do? What should I do? Oh! Expert in pubic lice treatment. Dr. Ika and Assistant Farah. Call us if you have any question or if you need any treatment.
Hello, is this diagnostic center I'm talking to?
Hello. Yes, miss. This is Farah, the assistant of diagnostic center. Anything I can help you?
Oh yes, Miss Farah. I actually want to meet Dr. Ika because there are several things I want to ask her about pubic lice. May I know how can I meet her?
Of course, miss. You just need to set an appointment with her. When do you wish to meet her?
As soon as possible, please.
Okay, then I will set your appointment with her on this weekend. Is that okay?
Absolutely perfect. Thank you so much, Miss Farah. I really appreciate it.
No problem, miss. You're welcome.
Hi Nisha, I heard that from my secretary, she said that you are currently trying to contact me regarding your cousin, I think, or your friend who are possibly infected with pubic lice. So first things first, you have to make sure the symptoms, because symptoms is like a clinical sign where you have to check on it, and if the possible symptoms are present, so it will be easier for us to diagnose. After getting pubic lice, actually it takes several weeks before any symptoms to appear. The earliest will be around 5 to 7 days in a week. Actually, the symptoms for men and women are the same. It is including, first thing is itching in the affected area, especially at night, because we know lice are very active at night. They are nocturnal animals. And then the next one, the inflammation and irritation caused by the scratching. So in case it goes very uncontrolled, then your cousin might have scratched the area so much until it becomes inflamed. Next, you can ask your cousin to check whether she managed to see any black powder on her underwear. This is actually a residue from the pubic lice. Next is blue spots or small spots of blood on your skin, such as at her thigh or in the lower abdomen. This is because the lice bites sometimes manage to bleed your skin area. I think that is very rare for pubic lice symptoms. So once you manage to see that if the symptoms are present, it is for sure it is a pubic lice. Sorry, because just now I have a patient. So now I will continue back about our discussion about pubic lice. So where do we stop? Okay, itching. So why do people who have pubic lice itch? It is because it is the most common symptom for pubic lice, as it is an allergic reaction of our skin towards the pubic lice saliva. And then next, I will touch upon after you find out all those symptoms, what you need to do. So the diagnosis of pubic lice, first you can go to a sexual health clinic, or we always call it as genitourinary medicine or genitourinary clinic. And then they are often located in hospitals, health centers, and they usually have a new department of it. And then we will start diagnose it from your eyelashes. So if the lice aren't in your eyelashes, the pharmacist can also give advice of the treatment, and we will look through by what we call the magnifying glass. So then the doctor or nurse can use a magnifying glass to look upon for signs of the lice. Usually it is a pale colored eggs or the lice themselves. Check your hygiene, check your places, check your dorms, check your house or clothes. And I hope after you go to the clinic, then they will provide a useful specific medicine for pubic lice, and I think you'll be as good as new. I think that is all from me. In case that you need any help, Nisha, give me a call. And I hope that your cousin can get well soon. I see you guys. Bye.
Have a seat, miss. Now I will tell you more about pubic lice treatment and how to prevent it. For the treatment, the first thing to do is to remove the pubic lice and egg by using over-counter lotion or anti-lice shampoo. The egg may remain on the hair shaft, so remove with the fingernails or fine-tooth comb. A mirror, a magnifying glass, and a bright light may help in this case. Second, treatment may need to be repeated 9 to 10 days later, so do follow up and maintain. Third, if the lotion isn't effective, comb are not enough to remove lice, especially in eyebrows, please consult with the healthcare provider. We can prescribe the grade petroleum jelly to eyelid 2 to 4 times a day for 10 days to be effective. Please don't use the regular petroleum jelly such as Vaseline because it can irritate the eyes. Next, to prevent from this pubic lice spread more, avoid sharing clothes, towels, and bed with other family members until finish the treatment, and wash regularly all your stuff. For stuff that cannot be washed, dry clean or store in plastic bag for 2 weeks. Second, if possible, do avoid the close contact with the people around you. Third, check other family members whether they have pubic lice already or not with a doctor. Don't worry, these pubic lice are easy to treat and do not cause serious health problems. That's all I could share with you. Thanks for listening.